I'm talking now to Rachel Bannister, whose daughter previously spent time in child and adolescent mental health hospitals. Rachel, morning to you.
Morning.
Thank you for coming in.
Thanks, Sally and Ben. It's great to be here.
We heard Steve's story there, didn't we? And it's a shocking story, but it's not an isolated case by any means, is it?
It isn't. I mean, it is utterly heartbreaking, you know, to see stories like this. And, you know, from a personal perspective, to know that could have been us, it could have very easily been us. And you're right, it isn't an isolated case. You know, these things we hear about week in, week out across the whole of the UK, and it's just not acceptable. But if we look at the context, yes, there's a mental health crisis now, and it's got a lot worse since the pandemic, you know, we know that. But this crisis in services and lack of staff and investment has been building up for many, many years, and particularly over this decade. There's been massive cuts. We've lost staff. We're struggling to retain staff. And, you know, we're made promises by those in power, you know, from government to say that they're putting this extra money in or this extra amount of staff, but there isn't a context to that. We've got to look at the nurses we lost in this decade and the doctors that we've lost. You know, retention and recruitment of staff is a really, really big issue, and if we don't get that right, we're never going to improve things. And I also think with inpatient care, yes, we do need more acute beds, absolutely, but it shouldn't be the default option. Young people shouldn't be left to the point of crisis, so then, you know, they're having to be admitted to hospital. We need early intervention and in the community, so we need more beds, but we also need much, much better, well-structured, evidence-based outpatient care. And there are really good examples of where it does work really well. There's the Royal Free in London, who treat patients in the community with eating disorders like my daughter, who very rarely hospitalise them. They've been up and running for 10 years. They've lost no young people, no deaths.
You mentioned your daughter. That's how you have such wide experience of this particular issue. What happened to her and to your family?
So this is a few years back now. She was about age 13 and I started to have concerns about her mental health, and we took her to the GP, and we were very lucky. We were seen by a lovely GP, very compassionate, experienced, and referred us to CAMHS pretty quickly, really. So we were seen really quickly. But the trouble was, even back then, 2013 I think it was, there wasn't the resources and the staffing to offer her the holistic care that she needed. And naively I thought we'd turn up at CAMHS and they'd have this mental health toolbox with everything you could possibly need to make her well. And never in my, you know, worst nightmares did I imagine that we'd have a 2-year wait for any treatment to begin, really. I mean, she was seen in the community by some brilliant staff, but just not often enough, and it wasn't holistic, and it didn't include all the health professionals that, you know, she needed, like an OT, a dietitian. And then when she deteriorated, we were then said that there weren't any beds, and she was sent 50 miles away, and then 100 miles, and then latterly 300 miles from our home in Nottingham to Scotland. And you can imagine the trauma for her, you know, a young teenager, you know, in the prime of your life in lots of ways. Your personality is developing, isn't it? You want to be with people that love and care for you. You don't want to be ripped out the heart of your family. And the other thing I think we don't talk about often enough is the effect on the whole family, the entire family. And it's affected all of us. My daughters were out of school. My middle daughter's had a post-traumatic stress disorder diagnosis, and I ended up really poorly myself. So it's not just the young person, it's everybody.
How is she doing now, and how are you all doing?
Well, we're okay, but I think, and we're on a recovery journey, all of us, but I think it's because of luck, really. And it shouldn't be down to luck, should it? You know, what a dreadful indictment of services, that survival, you know, is a matter of luck. And I've put my head above the parapet. I've, you know, spoken out and not accepted when things aren't good enough. Eventually, I wish I'd spoken out sooner. I've got a partner who was in work when I had to give at work, so we've had, you know, like a secure family-based extended family that have been brilliant. And we're really lucky because our clinical commission group pay for trauma therapy, so they've offered us a therapy that she's now had for 5 years, and she's had continuity of care, which she hasn't had before, so the same consultant psychiatrist for the past 5 years, and we're absolutely no doubt that's what's kept her out of hospital, you know, because she's had that continuity of care and a different therapeutic approach.
It's difficult, isn't it? Because I can imagine if parents are watching this at home this morning and they're concerned about a child, they might think, I don't even know where to turn.
You know, and exactly, and the waiting list and the thresholds now to get care is even higher than it was when it was back then. I mean, the whole thing that's happened to us, and I'm so grateful that we've still got my daughter with us, because when she was in the last unit, you know, it became a dangerous place. It really did. And if it wasn't for a conversation I had with an NHS manager who listened, heard, validated what I was saying and got her out of there, we could be in the same situation as Chelsea's dad. But I've set up a charity now, Mental Health Time for Action Foundation, and we are a campaigning charity, but we have another side as well that we fundraise. So if there's anybody, any companies or people that want to sponsor us, we've got a fundraiser that's on the go, and we'll be able to offer people places at the charity where we had the therapy ourselves. That's been life-saving for our whole family. Matt Goss has just pledged to write as a Mental Health Time for Action pledge, so he's on board with us, which is amazing.
Wonderful.
Yeah,
that's great. Great to hear Matt Goss is busy outside the studio as well.
Yes.
That's fantastic.
Yeah.
Good work out. So Rachel, thank you for coming in and sharing your story with us. And good luck with the work. As you said, so important. So thank you very much for coming in.
We should just say we've had a statement from NHS England. They say we are working hard to transform our community services and have invested record amounts in mental health care for children and young people to meet record demand, including boosting our mental health workforce by 40%.
Yeah, so they've also rolled out 24/7 crisis support lines 2 years ahead of schedule, they say, to make sure that more than a quarter of children and young people have access to dedicated mental health support at school or college. And if you've been affected by any of the issues that have been raised in our chat this morning, you can find out help and support, as much more, bbc.co.uk/actionline.